Oh yeah, no, we're still like, sorry. Yeah. So, oh wow, okay. Yeah. Anything I learn, I will let you know.
Whatever you want. Trump's going to have a press conference at the top of the hour now. Trump's going to have a press conference at 2.
Out. We have to start for the president at 2. You're going to have more news than I thought we were going to have today. So thank you for your time.
So we're going to what?
We're going to start before 2. The president goes on at 2. So a couple more minutes, but you're going to have more news than perhaps we thought was going to happen. So thank you for coming out. Not yet. How's it going, Marcus?
Summer of '64, came around right. Other than that, there were no battles.
Well, there wasn't any. Yeah.
I hear him dial, but I hear nothing right now.
So there was no reason to postpone the election. There was no war going on in the state.
That's exactly right.
Yeah, but does it matter? Yeah.
Could it be totally
At some point.
I alone trust.
See, it won't slide back.
No. You're bad.
Everything was, there's been so many, so many different levels. Hello, sir.
But they also
Did you? I did. You did a beautiful lineup for,
it's almost the same in the circular firing squad.
yeah, I know, but that's a new color. You have to go get one. It's,
I think it's
yeah, it's not a great.
It's not live.
It's not sort of like a split piece suit. It doesn't look very.
It's not live. It's not billions.
Which guys good? Out the bile? Yeah, out the bile, yes. Does have that ability. Really? Put these together were so hyper educated that they were doing these directions
There were full of jokes that no child would understand.
exactly.
I know there was a meeting today between 30 to 40 during this difficult time. So.
Councilman Banks?
I copied Doug's design. I went and bought the unit structure. And we can put one. I have more clips. I can put them over there too, but it's not going anywhere. Like I hung on it.
Yeah.
So I'm gonna buy a safety cable with an eyelet to put.
How do you make sure that it's in focus? Is the problem? You'd have
Well,
to.
the 5D
You're gonna have
Mark,
to.
the 5D Mark IV, you can
look
connect
at it
to
with your phone.
Yeah, that's
Okay.
what I would use.
Yeah,
But
that makes sense.
yeah, I have the ball head. I'd like to get a ball head like Doug's, but they don't make those anymore. The ball head without the plate, they're very hard to find.
I've got one of those actually.
You know what I mean? Like eBay's got them, but they're awesome. So mine's got a little plate on it. I'd like to get the one that's or I might
like this,
or I might just buy the end of that part and put it on there. You know, just the camera plate. And put that on there. So that's electrical hanging a box in industrial. So I got it at Home Depot. It was like $12 for all the parts.
And you just did that this morning?
Yeah, I brought my wrenches earlier. So it's I got the idea from looking at Doug's how he did it.
So have you put the camera up there
I have not yet.
connected it to your phone to see what you can get?
I haven't yet. I didn't. I was gonna.
You should give it a try.
I figure we're gonna
Not
do
today.
it. Yeah, but I'm gonna. Because that's why with the 5D it'll be easy.
Yeah, yeah.
Tell me I can do it.
I wonder if you could do that.
You can. You have to get the app.
Thank you, Steve. Appreciate it. Guys, I didn't know you were here. That's like, comes out, you know, it's too professional, but otherwise.
No.
Otherwise, it's all good.
Oh, she don't have one?
Wait, what about this one here?
No, we have our own.
Okay.
A different one.
They're watching. No one showed up. No one got rejected yet.
No. Middle and the right side.
I don't think so.
They gave a 2-minute warning and some it's like 20 minutes.
I did not hear of anyone that.
All right, thank you very much, I didn't know. They still didn't answer the question. That's cool.
We're not going every other week.
Why did you make me COVID-19 meetings in the situation going classified?
Hey, how are you? Good to see you.
Like this, same thing?
Or are you wired?
You want me to stand up and put you? Yeah.
But those labs, as I noted a few days ago, have been supplemented by hospitals from Stanford to a number of UCs, City of Hope, as well as our private lab, Quest, in San Juan Capistrano. I'll remind you that Quest currently is operating just one lab in the state of California and conducting roughly 1,200 tests on a daily basis. That will substantially ramp up in the next week or so with the 2 additional labs that will come online. We'll get those tests just from that commercial lab up to 5,000, as much as 5,500 a day. But the total number north of 8,000, and we are increasing our capacity on an hourly basis, not just a daily basis. Accordingly, we have advanced a partnership that was initiated well over a week ago with Verily, the health and life science subsidiary of Alphabet. We advanced that partnership with the idea of bringing to market the capacity for individuals that have developed mild symptoms or are concerned about their status from the perspective of being in a vulnerable population, be it our seniors or at higher risk of contracting the disease, to give them the opportunity to go on this portal, to answer specific questions, to be scored in terms of their likelihood to be needed to be tested, and then be allowed and directed the opportunity to be tested at what will be at launch 2 specific sites, one in Santa Clara County, one in San Mateo County. That portal, that page that allows people to interface will go online tomorrow, and we will then begin to make reservations, and people throughout the course of next week will be in the opportunity to get the mobile testing that so many are discussing and so many have promoted. We expect that those 2 pilots, one in Santa Clara County, one in San Mateo County, will significantly expand to other parts of the state. We have a deep eye and consciousness on the Central Valley, other parts of the state. We want to make sure, from not just a density of concern, Santa Clara being one of our top priorities as a county, that's the answer to why we're starting there, but more broadly, that we look at the issues of socioeconomics and access as a big part of the advancement of the Verily partnership. We hope that this partnership can scale, and we believe it will be a national model. There's simply no other interface that exists in the United States that allows people a portal that has questions and the capacity to geospatially identify where people are, so we can identify the closest areas for mobile testing that we're aware of in the country. And so we are very encouraged by this partnership, very enthusiastic to finally announce it. I know there's been some conversations about it in the media, but it is going live this week in the next 24 to 48 hours, fully operational in the first 2 piloted areas in our state. We have the capacity currently through the assets in hand, be it swabs, and that's an issue that I will discuss in a moment, the issue of swabs, not just the issue of reagents, not just the issue of RNA extraction kits that are part of our testing regime, but also the availability of swabs. But the first tranche, we have over 9,000 test capacity with the swabs, and we will partner with Quest in terms of the diagnostics of those tests. And the turnaround is typical at Quest, anywhere from 2 days, some cases 3 days, is roughly the estimate. People will be automatically notified based upon that screening criteria and based upon that interface on that portal of their test results. If people have severe symptoms, this is not where we want you to be tested. This is just a test. If you have severe symptoms, you need to engage the medical community directly. And so we want to remind people this is not to substitute that interface, but to supplement our capacity to get people that have some mild concerns and or people that are higher risk, to remove them from overburdening our healthcare delivery system, to get them out of that setting and to allow people with the kind of portability that mobile testing provides to get answers quickly. But again, it's just a test. And so I just want to remind people of that framework and not promote it for something that it isn't. So we're moving into the next phase as it relates to testing in the state of California. Broadly, I think in the United States, there's still some capacity concerns, not only on the diagnostic side, on the back end, with the labs, both private, public, commercial, but as it relates to supplies, and one must be honest about that and forthright about it, but significant increases nonetheless in the testing protocols are being advanced, again, I think quite substantively with this new partnership. As it relates to the purpose of developing these partnerships, the purpose of our testing, that is to identify through community surveillance where we are, so that we could begin to process how we need to manage the status quo and how we need to anticipate the growth and spread of the virus and look at allocating resources across the state accordingly. I mentioned this a few days ago. I'll remind folks, we have about 74,000 hospital beds in the state at 416 different hospitals. We have surge capacity in our state just shy of 9,000 beds, 8,661 beds to be exact. And that is on the basis of current survey that's very contemporary of the existing hospital system. We have about 11,500 ICU beds in our system, but that's not just for adults. That also includes pediatric ICUs. It's just shy of 11,500 when you add the two numbers up. We have new and detailed information about access to ventilators, over 7,587, not over 7,587 ventilators currently reside in our hospitals, and we have procured new ventilators, a few hundred that we were able to purchase, and we also have our own cash, both through our EMSA and our CDPH sites that include an additional roughly 900 ventilators in addition to the 7587 that I referenced. So I give you those numbers because a lot of people have asked about that information. Those are the most up-to-date and contemporary numbers. I also make that point as a point of consideration and segue to the subsequent announcement. And that is, as we manage this disease and the dynamic nature of this moment, we need to anticipate spread, but we also need to prioritize our focus. And the purpose of today's announcement is to focus on specifically what we mean by that. Most important thing, again, is to protect the most vulnerable, protect our seniors. In the state of California, we estimate we have 5.3 million Californians that are 65 years or older. Of those 5.3 million 65 years and over, we are prioritizing their safety because of their unique vulnerabilities to this virus. We also are prioritizing those with chronic conditions and prioritizing our homeless. And it's in those three areas that I want to advance some new considerations for the public and new direction for the people of the state of California. We are calling for the home isolation of all seniors in the state of California. We are calling for the isolation, home isolation of all of those 65 years and older and those with chronic conditions. We are doing so with our eyes wide open at the magnitude of what that means and the need to provide wraparound services to support our seniors in need of medical supplies, in need of meals, and the like. The team assembled behind me, and the people in this, what we refer to as SOC, our State Operations Center, of where we reside at the moment, currently have 13 task forces that are working on a panoply of issues, from logistics, from things as basic as not just food, but water, fuel, and basic supplies, to more complex issues related to workforce and the like. And so we are looking at this from a very holistic perspective and holistic lens. We recognize that social isolation for millions of Californians is anxiety-inducing, but we recognize what all of the science bears out and what we recognize around the rest of the world, that we need to meet this moment head-on and lean in. not isolate ourselves to this moment, but lean in and own this moment and take actions that we think are commensurate with the need to protect the most vulnerable Californians. Number two, we are directing that all bars, nightclubs, wineries, brew pubs, and the like be closed in the state of California. We believe that this is a non-essential function in our state, and we believe that it's appropriate under the circumstances to move in that direction. As it relates to restaurants, we have more nuanced concerns and considerations. Some have suggested just shutting down all of our restaurants. We don't believe ultimately that is necessary at this moment. Consideration, nonetheless, is to socially distance patrons within these establishments. And as a consequence, we are directing that we reduce the current occupancy within these establishments by half, and we require social distancing within those establishments. We will provide some flexibility in that space, and we could talk more about what that may look like. But in broad strokes, that is the current directive, and we will in real time absorb the capacity to potentially do more, but also try to reflect on the enforcement side of this, which I'm not concerned about, because as you had noted, with all of our directives, we are seeing a socialization in real time and strong and broad support, not only from the public health officials up and down the state, but the private sector that has done a remarkable job meeting this moment. So that's on the restaurant side. Let me just briefly make this point. There is a concern around access to food for those that cannot prepare their own food. Not everybody has kind of kitchen you or I may have. Not everybody is capable of heating their food. Now we're talking about home isolation. Not everybody is able now to go out the grocery store to get that food. Some may have limited capacity as it relates to deliveries, but we want to expand the points of access to get those deliveries. Restaurants, by definition, provide those points of access. So having an organized construct that allows delivery of hot, prepared, and nutritious food within an existing infrastructure, we think is appropriate, again, to this moment, with the additional steps on bars, nightclubs, wineries, brew pubs, and the like. Number three, in relationship to seniors as our top priority in home isolation as it relates to bars and new guidelines on restaurants, I referenced the issue of homelessness. This is a top concern in the state of California in the abstract. We have 108,000 unsheltered homeless individuals in the state of California. We need to meet this moment aggressively. And I can assure you, I mentioned 13 of our task force teams that are residing in this building. They are our teams just working 24/7 on this issue to get people out of encampments and get people into environments where we can address their growing anxiety and our growing concern about the health of some of our most vulnerable Californians out in the streets and sidewalks. We are in real time procuring hotels and motels to convert to appropriate sites. We have just identified as just an example. This is not even close to the magnitude of what we are proposing, but it's just a point of consideration and a proof point to give you a sense of what we're doing. We have additional 450 trailers that we have identified that will be dispersing to critical points across this state, and we're working to address the needs within the shelters so that, again, we have appropriate distancing and we are appropriating ourselves as it relates to social mixing for those vulnerable communities as well. So that's another area of deep and disproportionate emphasis that also we are advancing as a directive. As it relates to, again, vulnerable populations, you saw yesterday we put out guidance as it relates to an executive order directing along the lines of what the CDC and others have been recommending. We codified that in the state of California on visitation in our senior facilities, our skilled nursing facilities, our assisted living facilities. We now are tightening those directives to just end-of-life visitation, and that includes hospitals, not just congregate living facilities in the state. So that is also part of what we're advancing here today. So that gives you a sense of some of the current thinking of our healthcare professionals. Again, a number of them behind me. We have our finance team here and others in this building. We are gaming out the financial impacts, not just to the state's budget, but with disproportionate focus on families and individual budgets. This is a very different challenge, a very different crisis, and we need to meet this moment even differently than we did in the 2008, 2009 years. We have to really focus on individuals. So looking at our unemployment insurance, our disability insurance, looking at how we can complement what was done at the federal level. We're also sharpening our focus on what we request of the federal government going forward, as we believe the extraordinary work that has been done by Speaker Pelosi and her colleagues, and we hope soon by the United States Senate, can be complemented with even more support that we think is necessary to meet this moment. In more parochial, for some more pedestrian issues related to our work with the California legislature. We're in real-time conversations with the legislature about our current budget and how we'll process the concerns and anxieties people have about quote-unquote business as usual, an environment where business cannot be as usual, and we'll be making announcements on that in the next number of days, probably in the next number of hours potentially, and certainly tomorrow. On the issue of